Welcome to the Labour Force. I'm Bongeni Muchwa. Members of the National Health and Allied Workers Union are set to down tools at the National Health Laboratory Service from tomorrow over salaries. The National Health Laboratory Service conducts tests of patients at public hospitals for infections such as HIV/AIDS and tuberculosis. Of late, the state laboratory is at the forefront of testing for the deadly coronavirus pandemic in the country. Currently, state laboratory employees are not classified as essential service workers like nurses and doctors. The government is now in the process of approaching the CCMA to have them classified accordingly in order to avert the looming work stoppage. NEHAWU has briefed the media on the stage of readiness and details of the implementation of its program of action to defend and protect workers against COVID-19. For more, I'm joined by the union's General Secretary, Mr. Zola Saphetha. Mr. Saphetha, good afternoon and welcome to the program.
Good afternoon to you and the viewers.
Let's start with tomorrow. You are now poised to lead workers out of the job at the National Health Laboratory Service. Why?
Tomorrow, we are not necessarily taking out our members. They will be at work, but we will be having a picket demonstration as an expression of our discontent and our unhappiness as it relates to the failure of government, of the employer to give what is due to us as agreed last year.
What exactly are you demanding?
Last year, we ventured into an agreement where we discussed issues related to the performance management systems, the issues related to bargaining issues that are in an agreement. Unfortunately, the employer doesn't want to go back to those issues and they are forcing us to look to the next round of negotiations for 2021 and already indicated that there shall not be any increase. So that's why we are insisting that let's implement what would have been agreed last year before getting into the new round of new cycle of bargaining.
All right, so just to get it clear, you are not starting a strike at the state laboratory tomorrow. It's only just picketing for now.
We are starting our strike. Remember, we have a certificate to strike, but as part of mobilizing our members and grounding them for a full-blown strike, we'll start with different activities. So tomorrow, it will be a picketing as a starting point, building up to our strike. And our strike, remember that we are using NHLS as well as the launching pad for the broader implementation of our national program of action that is expected to take place as from Monday up until the 10th of September.
Now, speaking about that program of action, of course, you were complaining that there is a shortage of PPE at hospitals and that's putting the lives of your members at risk. Is there any improvement on the ground in as far as the supply of PPE is concerned?
Certainly no improvement. That's why we are pursuing our campaign. And we have secured also some donations which we want to discuss with the department as it relates to the distribution of the PPE, but also expecting to hear from the department as to, from having met with us on the 30th, what is it that they've done to ensure that PPEs are procured and are delivered as soon as yesterday, and taking into account that there have been some discussions between NEHAWU provincial leadership and the MEC and HODs in all respective provinces. So hopefully, once we gather information this afternoon, we will be in a position to see whether there's an improvement or not. But as it stands, there are no improvements.
Well, after you announced your national program of action, the Health Minister, Zola Saphetha, came out publicly and said the concerns raised by yourselves as Labour have to be attended to. It's almost a month now, and you're saying that nothing has happened. Is that what you're saying?
We have met with the Minister, accompanied by his deputy and the Director General and Deputy Director Generals, including MECs and HODs across provinces on the 13th, which means last week. That meeting could not really resolve all the substantive issues Rather, it put a process which is a three-prong. The committee led by me on the part of NEHAWU and led by the DG, which is supposed to meet this evening, and also there's a task given to the minister, but also provinces were directed to meet to get first and verify information as it relates to the establishment of health and safety committees at the workplaces, and in areas where such are not existing, they must put plans so that when we reconvene in the next 2 weeks, then we can have a concrete way forward. And also in that meeting, we're expecting to pick up whether or not there's been improvement or not. But as things stand, there are no material improvements brought to our attention.
Are you therefore saying that a strike in the public health system is inevitable on the 10th of September from where you stand right now?
It's not only in public health. In all sectors where we organize, including private, the strike is inevitable. The only thing that will come between us and the strike is when really we see a material improvement as it relates to all the 7 key findings that we have brought forward and to the attention of all ministers that are affected as it relates to the plight of workers.
Well, Mr. Saphetha, unfortunately, we have to leave it there. And good luck to you. And hopefully, we don't see a strike at the height of the current pandemic. Up next, the Alternative Investor with Nastasia Arendse. Stay with us.